Hello, this is your deep dive into Diastasis Recti. I want to talk about what causes it, how we can best manage it, and different things that contribute to a Diastasis Recti. So I want you to think about your core as three chambers. So you have your thoracic chamber, which is from your shoulders to your rib cage. So the base of that is your diaphragm. And then the next chamber is your abdominal chamber, and that's from your diaphragm down to the top of your hips, your hip bones. And then your pelvic chamber is the hip bones down to the pelvic floor. So your pelvic floor is the base, holds everything up in there. So all of that, three chambers. Think of these like balloon chambers. So they are constantly moving in and out, and they can affect each other. So basically what Diastasis Recti is a mismanagement of pressure within those chambers. So our goal is to manage that pressure well. So what this pressure comes from is our insides, all of our organs, everything that's inside a baby, that's vagus pressure, and then our breath, so the air in there. So there's air pressure, and then there's also stuff in there. So that's all your intra-abdominal pressure. Also think of your core kind of like a sock. It stretches, you can put it on and off your foot, but if there's something that's putting pressure on it constantly in a direction that it may not like a big toe or like a bunion or a heel spur, that sock is gonna get thin and wear it out in that spot, and then eventually out pops a toe. We don't want that to happen. That's the extreme case of a hernia or something like that, but that's basically what's happening, is that constant pressure wearing that down, thinning, and then eventually a hole. So that's what we want to avoid, and that's what we're trying to heal and manage that pressure inside. Things that contribute to this pressure or mismanagement of this pressure is alignment, mobility, and your breathing. So we're gonna focus on those three things. Okay, so first off, alignment. How does this affect our diastasis? Alignment is how we hold our body, and believe it or not, it's all connected. So down to our feet, so how we're holding our feet, what kind of shoes we're wearing, up to our knees and our hips and our rib cage, our shoulders, our head and neck. So all of that contributes to pressure on the connective tissue within your core. The linea alba is attached to your sternum and your pubic bone, so it stretches that way, as well as all the other connective tissue that goes around our rectus abdominis. If that's being pulled on, then the linea alba will be pulled on as well. So it can be pulled long ways and out ways. It likes to be stretched. It stretches better the long ways. So the lateral way kind of puts more pressure on it, but too much stretch in any direction with mismanagement of the pressure, that's where the separation occurs and where trouble healing comes in. And this alignment stuff is super important with carrying kids around. So not only do you want that neutral posture and alignment while you're standing and going about your day, but you want to especially remember that while you are lifting and carrying kids. If you're carrying a baby, try to keep those hips neutral, your ribs stacked, trying to avoid this forward hip motion. That's gonna put a lot of pressure on that linea alba. Also any constant resting on one side, again, that's gonna be pulling things in different directions, and then lots of pressure where we don't want it. So keep in mind while you're carrying these cuties to keep that alignment. Okay, so what's the optimal alignment to nurture this diastasis back to health or avoid a diastasis? So we want to find a neutral position. So it starts with our feet, toes facing forward, and we want to avoid always leaning on one foot or the other. We want to try to keep that even weight on both feet. And you want to, if you can, avoid heel raised shoes. So I highly recommend zero drop shoes. I'll talk more about that another time, but zero drop really puts your body in that neutral position when you're up on your toes constantly, that puts your pelvis in this anteriorly rotated position. If your linea alba is to connect to your pubic bone, that's going to stretch out that linea alba, putting more pressure on there. So a zero drop shoe, so same distance from the ground, heel to toe, is going to be optimal. So if you can, aim for that. And then up to your knees. So you want, in a neutral position, your knees are facing forward in a neutral position. So avoiding any majorly external rotation or inward rotation. Try to focus on that facing forward kneecap, your hips. So again, you want to avoid always slouching to one side or the other. Try to keep even weight distributed. And then find that neutral pelvis. So anterior tilt, posterior tilt, you want to avoid those. You want to find that neutral position. So your hip bones, the front of your hip bones right here, should be in line with your pubic bone. So anterior rotation, they're going to be in front, and posterior, your pubic bone's going to be in front. So you want to find that neutral position where your pelvis just sits like a nice bowl. It's not going to tip forward or back. And then side to side as well. So you want to try to avoid those hip leans. Okay? With your rib cage, you want your ribs stacked on top of those hips. You want to try to keep those ribs knitted down. So oftentimes when we think posture, stick those ribs out. We want to knit those ribs down. That is going to keep, so linea alba again is connected to the rib cage. So if we're flaring our ribs out, that's going to stretch, and that's going to put that pressure, that abdominal pressure and lengthening of the linea alba. It's going to keep us from healing that. So ribs down, that's going to be important in your day-to-day posture and also through exercises and stretching. So we can rotate safely if we keep our ribs knitted down. So that's going to be important. Also, so move up to your shoulders. You want that nice tall posture, but you want to avoid the ribs flaring out to do that. So ribs knitted down, shoulders back and down. You can keep your ribs knitted down with your shoulders back and down. So think with your shoulders, nice wide collarbone. So it's more of those posterior shoulder muscles doing the work. It's not coming from arching the spine, lifting those ribs. Okay? So ribs knitted down, shoulders back and down, wide collarbone. And then your head and neck is just gonna sit nice on top. The ribs knitted down will really make the most difference here and through the movement that we're gonna go through. So just focus on tilting to one side or the other and where you're positioning your weight and your hips, ribs stacked nice and clean. Okay, next we're gonna talk about breathing. Breathing is so important in managing that intra-abdominal pressure. Your breath, that air, is the intra-abdominal pressure, but breathing will help us manage it, okay? So breathing correctly. So I talk about the connection breath postpartum, and that is reconnecting your muscles with your pelvic floor and your diaphragm. I wanna expand on that and talk about diaphragm breathing. So your diaphragm is like the drum muscle that goes at the base of your ribs. So it expands, like if you were to cut your trunk in half, your diaphragm would sit there. And when you breathe, it expands. And as you exhale, it raises up. So it goes inhale, exhale, inhale, exhale. Okay? So what we want to do is have all those three chambers working harmoniously in that breath. So we want to avoid doing a shallow breath where you're just up in your chest. You want it to go all the way through you. So inhale, I want you to put your hands right here on your rib cage. I want you to feel an expansion of your rib cage going front, side, back. It's 360 degrees and into your belly and lowering the pelvic floor. If we just focus on a belly breath, that's gonna expand that belly frontwards, and that's gonna put pressure on that abdominal wall, the linea alba, and we wanna avoid that. So we want to evenly distribute it, forward, side, back. So you should feel this breath go even into your back, expanding your ribs. So some feedback here, biofeedback, put your hands on your rib cage and inhale, expand those hands, and you should feel your belly and your rib cage going out in all directions, and you should feel your pelvic floor lower. So, and then exhale, lift, belly comes in, ribs come down. Okay, so try it again. Inhale, expand. Exhale, contract. Okay, so that's the diaphragm breath. I want this to be long and deep. And then when you're using it for exercise, we want to put it into a stability breath. So that is where you focus on the exhale a little bit more and pretend like you're blowing out birthday candles. So it's a little bit more power there. You can feel that deep transverse abdominis muscle contracting and those ribs knitting down as well. So inhale, exhale, blow out candles. You should feel those ribs knit down nice and tight. An exercise you can do here is put a band around those ribs, like exercise band, wrap it around, and then you will feel your ribs push out on that tension. This is a great way to increase the strength of those intercostal muscles, which are the muscles in between each rib. You can try that and focus on that expansion going into that 360 degree, and then exhaling, contracting it, and finding that neutral position. So when you're exhaling, you're finding that neutral hips, neutral ribs, coming back to your base neutral position. Okay, lastly, I want to talk about mobility. Now, why does mobility matter? You might think, well, we don't want to stretch our linea alba, we don't want to stretch our abs, it's already being stretched, we want to bring it together. But full body mobility really affects your core, and this is why. Everything's connected. Let's say upper body tightness. If your shoulders are tight and you're constantly on your computer typing or driving and you're always in this position, your shoulders are used to that position, then when you go to reach overhead, you're reaching something in your shelf, these muscles that are attached to that shoulder overhead movement are going to pull on your ribs, and your ribs are going to pull on those core muscles and the connective tissue, and that's going to, over time, all that movement, that's constantly stretching and stretching and stretching and stretching, and all of this gets more stretched. Or as opposed to if you have a nice range of motion with your shoulders, you're nice and mobilized there, that's just going to use your shoulder muscles, and all of this stays in place. Same thing goes for lower body. If your hips are tight, your legs are tight, and you're pulling on your hips some way, or you have it tight psoas, that's going to be pulling that pelvis down. And again, the linea alba is attached to your pubic bone. It's going to lengthen that. Any movement you go to lunge for your child or something, and you're constantly pulling on those core muscles in a way that they don't like, that's gonna keep causing that diastasis, and it's gonna be harder to heal, or it's gonna, if this is before your diastasis, it's gonna make your body more susceptible. So nice loose hip mobility, shoulder mobility, lumbar mobility, all of it, thoracic spine mobility, knee, feet, all of it, calves, it's all connected. So mobility is a big factor. And now I'm gonna walk you through some mobilizing exercises that you can do throughout the day that will help. And again, keep in mind, ribs knitted down through these mobility exercises, especially when you're twisting. That's gonna help you do all these movements safely without overstretching that linea alba and those core muscles. All right, I'm gonna show you 3 exercises, mobility exercises, so stretches that you can do on the wall that will work on shoulder mobility and rib cage mobility. So kind of separate that pull on your core, on the connective tissue. So start with your heels just a few inches away from the wall. And most important here is you want those ribs knitted down. So I want you to reach, if you cannot touch the wall without your ribs flaring up, then take them a little bit away from the wall. But try to keep those ribs knitted down, hands on the wall, and you're gonna go up as high as you can without the ribs flaring up. So keep those down and up, 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 up. Try to keep your wrist and elbows on the wall if you can, and then back. So you're just going up overhead, keeping those ribs down. That is most important. And then down. So that's just a great shoulder opener, working on that range of motion. You will feel a little bit of a muscle burn there as well. Another one is you're gonna reach, so same position, so feet can be a little bit wider here, just a few inches away from the wall. Hips and shoulders on the wall, and try to keep that neutral spine with your ribs down, hands out, and you're just gonna saw your body to the left and then saw your body to the right. So I have much more range of motion to my right side than to my left, so that's some good feedback. Try to keep your ribs down, so just side to side as far as you can go, with keeping neutral hips and ribs down and neutral ribs, so you're not side to side tilting, but you're shifting side to side. And then last one here, you're in the same position, hips and shoulders against the wall. You're gonna reach overhead. If you can't reach the wall without your ribs flaring up, so ribs down, reach up. You can feel with this hand, as soon as see my ribs start to lift there, so I'm gonna come back right here. I'm gonna put my hands together. I'm gonna do a half moon. So the goal here is to go directly to the side and not shifting, so side to side. So directly to the side rather than any like twisting forward or back. You want to go directly laterally to the left and right. Okay, so those are some good ones that you should feel kind of nice and mobilized after. Okay, the next three are on the ground, and if you have a foam roller, you can use it, or you can use something that's like this length and kind of heavy, like a pound maybe. And then down on the back, on your back, you want to get into, when you're laying down, you want to be able to keep those ribs down. So if you need to put something behind your head, bolster up your head on a little pillow. But the goal here is to keep, you should feel your upper abs working here to keep those ribs knitted down. That is the theme of all of this. So my ribs are down. I'm gonna hold this. I'm gonna go up overhead, keep those ribs down, 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 and then bring it back. And a slight squeeze on that object. So you're going back, ribs knitted down, 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 reaching and down. If you feel your ribs start to flare, then stop the movement, because we really want to avoid that. This is what's gonna help heal that core. So ribs knitted down, up and back. Okay, two more on the ground. I'm using a foam roller. If you don't have a foam roller, you can just go on the ground. It's gonna be a moving child's pose, but you're gonna keep a neutral spine and your ribs knitted down, okay? So don't give into the stretch and totally sink your ribs in. Focus on keeping those ribs down. You're gonna have your knees spread, your toes together. Sorry, my feet are really turning. We were at the beach earlier. Okay, palms facing up, and you're gonna slide, ribs knitted down, and you're gonna go back. Try not to tuck your tailbone either. You're going neutral hips, neutral ribs. Down, stretch those shoulders, and then up. So down, keep those ribs knitted, and down. So that should feel challenging on the core, keeping the rib cage. And then the other one is you're gonna be in this seated position. You're gonna put your hands behind your knees, and you're gonna keep your ribs down, and then you're going to shift your pelvis. So you're gonna do pelvic tilt. So you're scooping your pelvis, and then you're tilting it up. So shift, and here, so pelvic tilt, and without flaring your ribs. So keeping your ribs down, it's just the pelvic that is, pelvis, I always get that wrong, the pelvis that is moving. So shift, and here, shift, and here. So that should feel challenging as you're tilting it back to keep those ribs down.